Welcome to the Family Medicine On Air episode. My name is Jacqueline Nguyen. I am a fourth-year medical student at the University of Arizona Tucson campus, and I am currently serving as the Family Medicine Interest Group FMIG Network National Coordinator. Today we're going to talk about a topic that's very relevant and has been very persistent in the news recently regarding vaccines, immunizations, which has been sparked by the pertussis outbreak at Disneyland. Many medical students across the country today do not have the experience to see these vaccine-presentable diseases. They don't have the experience to recognize the symptoms early enough or even understand the importance of vaccinations now. With me today is Dr. Wergen from Nebraska. He is a family doctor who practices full-spectrum family medicine and is currently serving as the American Academy of Family Physicians president. Dr. Wergen, if you would talk about what medical students need to know about immunizations, that would be perfect.
Well, thank you, Jacqueline. And this is a very important point to me personally and as president of the American Academy of Family Physicians, who now represents more than 120,000 family physicians across the country and over 30,000 students. And it's an important topic for students to become comfortable and move forward with. As you indicated, my position is president of the American Academy of Family Physicians, but my day job is a practicing rural family physician in southeast Nebraska. And as part of that job, vaccination is on my day-to-day workload. And to me personally, and I think to our members, all 120,000, of all the things we do for our patients to ensure long-term health, I would say vaccinations is top on that list. And you're correct. There is a newfound interest in vaccinations after the initial measles outbreak in Disneyland just recently, who, oh, by the way, was first discovered on a Twitter by a young female pediatrician who said if you visited Disneyland during this time, you might want to look for these symptoms. And so the patients could recognize the signs and symptoms of measles and seek early attention. The other reason this is such a pertinent talk for me personally is my full name is Robert Leland Wergen. I'm named after my mother's two brothers. My uncle Leland, my middle name, was 4 years old when he died of complications of measles. So I do not want to see these diseases reemerge on the horizon, and we need to recognize the barriers that our patients see and start that education process right now with our medical students.
Thank you, Dr. Wergen, for that great intro. Now that we've heard from you, we've also collected some questions from medical students across the country. One of the questions the medical students have asked is, what is the most commonly cited reasons to not be vaccinated?
It comes up frequently in the office setting on well child visits, even with some of the adolescent, and adult immunizations. But I would say the most common concern is, aren't these adverse outcomes from immunizations going to be negative for my son or daughter here in the office? And of course, we align with those parents. Our main concern is that we provide excellent care for them. And so you acknowledge their concerns as a first step. And you, because of your relationship you've had with those patients for some time, they do recognize you as an expert in the medical area. So you acknowledge their concerns, but also emphasize those risks, although present, are very low and may be magnified in some of the media outlets they look at on the internet and otherwise. So use the acknowledgement, but education of the importance of those diseases, and to look back to the 1950s when I grew up, when polio was present, when meningitis or Haemophilus influenza during my training days was present. We don't want to turn the clock back.
Okay. And how do we counsel these patients if after all of these explanations, they still remain reluctant to get vaccinated?
Excellent question, and that does happen. And I guess I would use two words: cheerful persistence. Is revisit their safety, immunize their children, go back. I always also use the CDC handouts, which I got from our website, which you'll probably refer to later. So give them resources, but reiterate the importance of vaccinations, the very low risk, some of them in the range of being struck by lightning. You're more apt to be struck by lightning, yet you would still go outside, even in a rainstorm, because the risk is so low. So cheerful presence, education, go back and give them written material they can refer to later if they forget what we were talking about during that visit.
Okay. And what about when we're practicing or seeing patients with an attending or preceptor who doesn't believe in vaccinations? What can we do?
Well, that is a difficult position to be placed in, and it's part of your education process, because there are many opinions about vaccinations, and there may even be providers who don't feel that vaccination, the benefits outweigh the risk, or they feel these diseases are resolved now at this time. I think what I would do is take their input, but also have that discussion with them and say, gee, during my education process, I appreciate your concerns, and I certainly want to provide the best possible care to the patients I have after graduation from my medical school. But, as I see it, there are still these very low risk, but a large benefit from receiving these. And I accept your input, etc. But as a medical student, that is difficult. You might explore that conversation with them without being confronted, and then come to your own conclusions as well after that.
Okay. There has been a bit of controversy with the HPV vaccine. What's the best way to approach getting patients vaccinated against HPV? How would we talk to them about getting it?
Well, a couple ways, and I usually begin this conversation in young women, but also men. And I begin by saying, who would have thought there would be a vaccine to prevent cancer? And a safe vaccine. There's been no ill effects ever defined from giving the HPV vaccine, and it can be given to young men. And you might say, well, why do I vaccinate young men? Since we're about cervical cancer, well, there are also there are warts you can prevent on the vaccine. There is exposure. That's how men and women get it, through exposure of someone with HPV. And then the importance of this series of vaccines that can prevent the outcome of cervical cancer in women, which is still present. In the 1950s, before the Pap smear was introduced, cervical cancer was the #1 cause of cancer death in women. And our first assault on it was, let's recognize these early signs and symptoms of this HPV virus, which we weren't aware of then, and we reduced the incidence of cervical cancer. Now this is the next step. Let's stomp it out by giving a vaccine that can prevent this very poor outcome of cervical cancer.
Thank you, Dr. Wergen, for your time and sharing your information and knowledge about this crucial topic on immunizations. For those medical students out there wondering what resources are available for you, we do have on our website, aafp.org/FM on air. Again, the website is aafp.org/FM on air. Various resources and links you can use. We have a link to the CDC regarding immunization schedules, a toolkit that the American Academy of Family Physicians, AAFP, endorses. There are also journal articles discussing immunizations and research done into them and possible adverse effects or lack of adverse effects. There are additional resources you can use when counseling patients, in addition to a link to an app that you can download and use. Thank you very much for joining us here today on Family Medicine on Air. We hope that this episode, What Medical Students Need to Know About Immunizations, has been very informative for you.
Thank you, Jacqueline. And it's an important topic as you become physicians, maybe one of the most important things you can do to help your patients.
Thank you, Dr. Wergen, for joining us and answering our questions.
Thank you.